Hi folks, this is Dr. Rob Cywes, and today we're going to talk about a relatively trivial in terms of life and death, but such an important issue to so many people. We're going to talk about this, hair loss. and where I am in my current age, the reality is that I've paid a price for my wisdom. It's the gray hair. But where I am, I don't care really about the color of my hair. I'm at an age where I care about absence or presence. And this video is not specifically, it has a secondary effect, but it's not specifically going to look at slow, steady genetic hair loss. We'll talk a little bit about that. What we're going to talk about is acute hair loss that so many people say, oh, a ketogenic diet must be unhealthy because you lose your hair. And I want to dispel some myths, and I want to talk about hair loss because so many people come to me and they're concerned about it. And yes, it's real. Yes, it happened. I can actually predict it's going to happen. It's going to happen, but it is a temporary, transient thing, and your hair will come back with greater robustness, greater thickness, better quality. So let's talk about this, because a lot of people are concerned about this as when they start a ketogenic diet, or really when they lose weight. So the place that I see it most commonly, hair loss, is in my bariatric surgery patients, where you take an obese, insulin-resistant, ill person, and you suddenly kill their best friend. You suddenly kill their best friend, which is carbohydrates and calories, and they lose a dramatic amount of weight. And during that time, their hair falls out in clumps, and they're panicked and they're petrified. And the internet has victimized people with hair loss dramatically because they love to sell you all kinds of wallet biopsy crap. Nutrifoil is the big, Nutrifoil, I made my hair. Absolute wallet biopsy. Oh, biotin, you have to take biotin. Biotin's so important. Here's a pill of biotin, and I'm on my this macronutrient, that micronutrient. Quercetin. Oh, you got to take that. If you understand why the hair is going to fall out, predict that, and why it's going to grow back, and strategies you can use to reduce the problem and to correct the problem, you don't need to spend a penny on care. People are taking advantage of you by selling you crap because they victimize you. They create a petrified status in you. I'm afraid, oh my God, what's happening? And certainly do not use hair loss as a reason not to lose weight. So let's break this down. Let's look at this. Hair follicles start as a fairly deep growth plate. Think of the root of a plant sitting in your skin, and then the shaft grows out, and the shaft is dead. It's made of keratin, a protein byproduct, and it's waxed up. It's greased up by wax from sebum secreting glands in your skin. So, but the hair grows from the bottom, from the roots all the way up, and the outside part is dead. And it is a waste product. It's a keratin, a protein breakdown waste product. So in humans, different animals are different, but in humans, we go through 3 phases of hair, but it's continuous. So we're not in one phase or the other because humans don't molt. The first phase is the anagen hair phase. This is when hair is actively growing from the bottom up, actively growing. And during this phase, the hair grows, and this is important, about 1 centimeter a month, about just a little bit less than half an inch a month. Call it half an inch a month. And what it does is the new growth pushes the old hair out. So it's always that way. And the length of that phase, where it's 28 days, 30 days, 2 months, depends on where the hair is. For example, in your scalp, the hair stays in this phase for around 2 to 6 years. So the hair is every hair is different, but each hair is by itself on the scalp, which is where most people are concerned about hair loss. Most people don't mind so much about body hair loss, but the facial hair and the hair on our scalp is what bothers most people. That anagen phase lasts anywhere, and I would broaden that, anywhere from 6 months to 6 years. And probably 6 months to 2 years is about the average time where the hair is actively growing. So that one hair follicle growing. And then a transition phase occurs where every hair somewhere between 6 months and 2 years, 6 months and 6 years stops growing. It stops growing. Plop, I've stopped growing. And then it gets into what we call a telogen phase, which is a resting phase. That is when the hair growth stops completely for about 3 months, 3 to 4 months. And the hair is then lost. And around, in a normal human being, around 6 to 8, maybe 10% of all the hair on their scalp is in this resting loss phase. So we are typically shedding off a normal head around 100 to 200 of those hair follicles per day. So you're in an active phase of hair growth. It then stops growing and it falls out, and then a new hair grows in its own in that place. That's the way hair works. Now, there are certain specific factors that can affect those phases. And one of those, the commonest one that we see, is chemotherapy. Chemotherapy are drugs that damage rapidly producing cells, whether they're cancerous cells or body cells. And one of the rapidly producing cells are cells in the anagen phase, and they get killed, so the hair falls out and you're not growing new cells. Now, it doesn't kill the hair follicle, but it takes a few months, maybe up to 6 months after chemotherapy for that hair to grow back. And at first it's a very fine hair, and then it's a more robust hair, and a year later, even if you've been on severe chemotherapy, you, for the most part, got your hair back. Radiation kills that rapidly growing cells. So if you've had chemoradiation, that hair won't grow back. But the chemotherapy is the classic one. There are other insults. Severe disease, any severe disease, any source of inflammation will have potentially the same effect. Not as dramatic as chemotherapy, where all the hair falls out, but where it's called telophase arrest, where the hair follicle stays in telophase, that resting state where the hair is falling out for a longer period of time. And the hair is falling out at a similar rate or maybe an accelerated rate, but the more important thing is it's not growing back at the same rate. So your hair is falling out and the new hair is not growing. So the cycle is disturbed. And that is the challenge, because all hairs go through that same follicular process. Now, genetically, you can destroy some of those follicles and they don't grow back. That's where the baldness comes in. We'll talk about that in a second. So any form of stress causes that. And so what's one of the biggest stresses in the human body? Because remember, the human body is geared towards survival. It's geared toward the accumulation of energy and nutrition. And any form of nutrient loss or loss of a store is seen as a bad place to be, as a threat. And the body shuts down a lot of functions. So anytime somebody loses weight rapidly, any rapid form of weight loss triggers telophase arrest or telogenic phase arrest. And what happens is your hair falls out, or at least it seems that way. You get chunks of hair coming out, and oh my God, I got bald spots. Not visible bald spots, but your hair gets thinner. Of course it does. And the most aggressive transformation is from a state of being, which is called insulin resistance on a high carbohydrate, when you suddenly, on a ketogenic diet, today I'm going to quit carbohydrates, and you suddenly stop and you lose a good chunk of weight. Your entire metabolism changes, but your metabolism doesn't change this way. It takes months for that to happen. And during that early phase, it is very common to have dramatic hair loss. Not only have you undergone a major stress to your body in order to get healthier, the second thing that happens in those first few months is you improve your insulin resistance. And insulin resistance is very androgenic. It's testosterone-based for a lot of people, not everybody, but females with polycystic ovarian syndrome, testosterone-based, a lot of males, testosterone-based. And the androgenic phenomenon, the male balding, that can occur as well. So you get the hormonal challenges, you get the defensive action where you stay in that telophase arrest, almost like you've got a chronic disease. And those are the causes of hair loss on a ketogenic diet. Doesn't mean you're going to be bald. So what are the ways to fix this? How do you prevent it? How do you reduce it? Well, the first thing to understand is that a ketogenic diet for weight loss is really no better than any other diet. It's going to fail. You lose more weight, you get a bit healthier, and then it fails. So stopping carbohydrates on any one day is ludicrous. Slowly removing carbohydrates from your life over time, over the course of a month or so, avoids the keto flu, avoids that hair loss. So a slow, steady reduction, be the tortoise, not the rabbit, a slow, steady reduction in carbohydrate consumption prevents or radically reduces telogen phase arrest, hair loss. Now, your weight loss may not be a sharp curve, it may be slower, but that's okay because the goal here is not just to lose weight, it's to keep it off. The second thing is when you start a ketogenic diet, make sure that you introduce healthy fats. Medium chain triglycerides, coconut oil, saturated fat, animal fats. Those fats help to protect the fledgling hair follicle. And make sure that your ketogenic diet is not a low-carb, high-protein diet, that it's a low-carb, high-animal fat diet, because the protein will come along with that animal fat. But the protein should not be excessive, because that keeps you insulin resistant. Remember, excess protein becomes sugar, and your body's desiring sugar. So you don't want to stay in that state and be at a caloric deficit. So as you decrease your eating, make sure you replenish it with adequate fat and slowly reduce your carbohydrate consumption. Don't do it all at once. Do it in stages. Get rid of the drinks that you're drinking that are carbohydrates, then get rid of carbohydrates in your meals, then get rid of the snacks, then get rid of the lookalikes. Severe sudden caloric restriction is the biggest challenge, as we see in our bariatric patients. Inadequate and excessive protein intake can be a problem. So don't go on a vegetarian ketogenic diet right away. The next thing is the ketogenic diet is very heavily focused on macros, protein and fat. Make sure you are getting a healthy range of micronutrients. You don't have to take pills. You don't have to take supplements. You don't have to. And anybody that recommends them for hair loss is creating a wallet biopsy. Oh, I must take my biotin. You've bought into someone's scheme. Eggs, dairy, fish, liver, avocado, excellent source of micronutrients. Make sure they become parts of your ketogenic change and things will get better. And especially if you lean a little bit more carnivore, everyone talks about, SIBO, small intestinal bacterial overgrowth. Oh, it's the GI biome that causes the hair loss. Don't buy into that, folks. Your GI biome will improve dramatically when you go from a fermentation process of sugars to an oxidation, a lipid oxidation process of fat. Change your diet from carbohydrates to fat slowly, and you will reduce the risk of hair loss. But no matter what, folks, remember this. Your hair will grow back more robustly. It may take a year to do so. But I promise you, if you are on a well-formulated ketogenic diet, low carbohydrate, high fat with adequate micronutrients and protein in there, your hair will come back better than ever. Better than ever. Now, here's what I don't have evidence on. I don't have evidence that a ketogenic diet specifically helps male baldness. However, if it has a positive androgenic effect, and we know that insulin resistance affects testosterone production, as your testosterone production normalizes, it'll reduce the rate at which your genetic hair disposal happens, because it's mediated through testosterone. So I can't promise you that, but that's the theory. And then the final most important part to hair restoration is this. The human body functions in a cyclical pattern every day. So at certain times of the day, we're eating, we're getting food in, and we are building tissue, we're building stores for our food. That's called an anabolic phase. And it's governed by human growth hormone, by insulin, and by T3, as long as you're insulin sensitive, thyroid hormone. On the flip side, at other times when you're not eating, we should be under the influence of what we call somatomedins. We should be under the influence of cortisol, and we should be under the influence of glucagon to use those stores. If you're in one phase or the other phase continuously, that's not a good thing. But if you get to a point where you're having 2 meals a day and you are, here's the focus, practicing intermittent fasting, going long periods of time without eating so that you can use up those stores, that ebb and flow from anabolic to catabolic and back again is one of the best ways to preserve hair function and to regrow your hair. That human growth hormone, that insulin, that T3 is going to help to grow the hair once you become insulin sensitive and fat adapted. So hair loss is expected. It doesn't always happen. It is reducible or preventable if you approach this scientifically with someone who's treating this not as a sudden rapid weight loss diet, but as a change in your way of life, something that we do in our practice. Don't be a victim of the wallet biopsies on the internet. Biotin, Nutrifoil, all the gimmicks for hair, please stay away from them. You're doing yourself a disservice. But eat a well-formulated ketogenic diet and make that a lifestyle, and your hair will be robust. I am the Carb Addiction Doc. If you want guidance, if you want help as to how to do this, give me a shout. 561-517-0642. If you hate this video, if you love this video, leave a comment, hit the like button, hit the dislike button, but interact with our show. We appreciate that. And I will try to get to all of your comments. I am the Carb Addiction Doc. Thank you.